So we are going to talk about survival strategies for small and medium hospitals. This is typically what you are seeing in evolving markets where as the small and medium hospitals are emerging, most of us do not come and build directly 300 hospital or 500 bed hospital. We usually start with a 25 to 50 bed hospital or a nursing home, and then it slowly evolves into going into a 100 bed hospital or 250 or 150. So there is a stepwise manner which people grow at. And if you are looking at these, they are typically defined any hospital between 10 to 15, which is a nursing home, from that range till something to the range of about 75 bedded hospital. Because about above 100 plus, they start going to medium range, 100 to 250, and then anything above 300 and plus will go into larger centers, which are super specialized centers. Of course, I'm not going to comment on the turnover because every hospital, based on the product they have, product I mean what specialty they have, they will have a different value, they will have a different turnover. Accordingly, their input is also very different in terms of you're putting up a cath lab or you're putting up CT, MRI, you're doing a neurosurgery suite. There will be a different cost involved. You want to do an onco-surgery or an radiation oncology. So there will be a different capex involved. In a same value, you can do a 100 or a 250 bed hospital, whereas you might end up with about a 50 or a 100 bed oncology facility because of the cost of equipment which will go inside. So let's talk about survival of small and medium hospitals, which is basically hospitals which are 15 to 20 bed hospital to somewhere about 50 to 70 bed hospital. And as I said, they are defined as the small and medium healthcare groups. Small and medium healthcare groups become a part of small and medium enterprises. If you are aware in the Indian sector, Indian economic if you look at the scene in the Indian scenario, there is majority of the employment happens in almost 70 to 80% of the employment happens in these small and medium enterprises. Part of it is also in the non-organized or unorganized sector. Similarly, in our scenario in healthcare vertical also, small and medium hospitals acquire a major stake. They almost come to take care of about 55 to 60% of the needs of the population. And I'm saying needs because they act as a quasi gatekeeper. They invariably take care of the routine 70 to 80% of the morbidity load, that is the infection load in the geography and the population. And then the later ones go into multi-specialty, secondary centers, which can move from a town to a city and a city to a metropolis. So that's how the whole migration of the population happens. Similarly, for treatment choices also, people move from a small town or a city, they come to a city, and from a city it moves to a metropolis. Coming back to these small and medium hospitals, they are, as I said, somewhere about 25 to 75 bedded. Up till now, you can qualify them till 99, 95 bed hospital. Interestingly, the first 5 years of any small and medium hospital is the most critical one. And that's the point when you initially start, you don't know what is happening there. You are new, you are an entrepreneur, you have set up a hospital. You are always counting on the number of patients. As a doctor, you are seeing what is my OPD, what is my number of patients who are walking in, and based on that you will say, okay, this is the amount of revenue I should generate. And when you have built a hospital, but naturally in that point of time, small and medium hospitals, many of them are now going into accreditation and stuff, but prior to this they were not doing all that. They don't have the know-how basically on what is happening in terms of external environment. We all witnessed during the pandemic of COVID. When the COVID hit, there were two sets of hospitals. There were some who got wiped out in the business, and these were the hospitals who were not ready they didn't adapt to the change. There were some who actually wrote off their debts of past 10 years. Not only they wrote off their debts, they made so much of money that now they are building up a 200 bed hospital. So there are two different, stark contrasts when you're seeing these hospital ranges, and that is called adaptability. Like any other, I think some of you are science students here, so you would know Darwin's theory of evolution as well as adaptability, survival of the fittest. How you react to the external environment becomes an integral part of your business or your enterprise. And of course, the second part is the lack of focus. And I've met so many doctors in my life who started off with a nursing home and they're saying, now I want to do oncology. You need to be very much aware that if you're entering into a different field, you have been doing, say, deliveries, you have been doing general surgeries. Doing a surgery is not necessarily your technical competence of running that hospital. If you're doing an oncology surgery, that doesn't mean that's the end of the patient care. The patient care will require chemotherapy, patient care will require radiation therapy, and you don't have the know-how to that. So it becomes very, very important that you need to be focused, and most of these hospitals over the time period lack that focus. It could be different factors. It could be change in the environment, it could be change in the your personal ambition is that now I want to be a 300-bed hospital owner, I don't want to be a 100-bed owner, I want a chain of hospitals. You need to be focused, what is your core competency and how you will go about it. I'm not saying you don't enter into in an oncology field. Please enter. Acquire the competency with you. Get people who are trained in that area to be a part of your business and then grow. So there has to be a focus. You cannot become defocused just because you are liking something. You need to develop that competency on board. And of course, as I said, the knowledge, you acquire knowledge. We all were not born doctors. We were all not born nurses. We all were not born health administrators. Over the years, we acquired the knowledge. We got trained in that. As a result of which, the challenges which are continuously faced by these small and medium hospitals, we need to be focused on that. Because that's where the topic is. We are talking about how they survive, and we have to talk about how we have to face that. First, we need to identify the challenges. As I said, in the external environment, we saw the pandemic, what it created a havoc in the system where you saw COVID-19 patients being coming in. Many hospitals said, no, I will not do COVID-19 because if I do COVID-19, the normal patient will not come. Unfortunately or fortunately, I don't know if you've been following, and during COVID-19, during when we had demonetization, there was a drop in number of orthopedic cases and neurosurgery cases. Any reason why? Anyone wants to answer that? Okay. So what he's saying is that what happened during the pandemic or during demonetization, where were most of the people? They were inside house or in the bank, in front of the bank. Okay, so they were the two only options left for you. People who were planning marriages, they were not traveling across the cities. People were stuck at one place wherever they were, either because of lack of money or because of the fear of the disease. You are staying indoors, you are not moving around. If you are not on the street, you are not doing any physical exercise. घर बैठे तो किसी की हड्डी नहीं टूटती. जब तक आप बाहर नहीं जाओगे, कूदोगे नहीं, 2-3 रिक्शे टांगे से नहीं भिड़ोगे, ट्रक से नहीं भिड़ोगे, हड्डी नहीं टूटने वाला आपका, unless you have a pathological fracture. So that's what transpired. As a result, neurosurgery ICUs, orthopedic ICUs were without jobs, and hospitals and nursing homes which were focusing on orthopedics, they were in a very bad shape. So what did many hospitals do? They said immediately apply, I will become a COVID hospital. Because I have a venti, I have this, I will get oxygenators, I will become an ICU, I will create an oxygen supply. So they changed themselves, and those who did not, of course, so that was a challenge on how they would have to react. The new act, the new rules which comes in the external environment, the government recently put up the new MTP Act. Now you can go beyond 24 weeks, which were till 20, so now it's gone beyond 20 weeks. And in case of various reasons, so many doctors were initially refusing up to 20 weeks. You are not aware that it has changed. If your competition is aware that it has changed, the patient will be going over there. And sooner or later they will say, उस doctor को कुछ पता नहीं है, उधर नहीं जाने का. So you have to be very clear that what are the rules which are happening. In the ART Act, I don't know, many of us are in IVF field. We know that up till now anyone could start doing IVF, but now government have made a registry. You have to go and enroll your center in the ART. Only there you can do IVF cases. You cannot do it at your home. Earlier, people would start it in their home. Chota sa area, usme bana liya. It would not happen like this. If you remember, we had GST coming in. Overnight, the hospitals got involved. You have to look at the input tax. You have to see the output credit. And people were busy doing that. The finance guy had to be very clear with it. You don't know what is happening. Your consumables got stuck. Similarly, in implant cases, DPCO guidelines came. Implants became overnight part of drugs, out of which cardiac stent, which you had margins of about 35%, came down to 4%. Implants came to about 7-8%. NABH, the new edition has come now. Okay, as a result, there is a further upgradation on certain services, inclusion of certain services, and some new rules to be followed for follow-ups on the stringent on the data process. So you need to be aware of what is happening in the statutory or legal fields. The same goes for your minimum wages, electricity bills. Like in Karnataka, in some states, they give you a 10% discount on your electricity bill if you're a healthcare service provider. Not necessarily it would be happening in Maharashtra or in other states across the India. So you have to be very much aware where I can get a 10% discount. If you are planning a chain of hospitals, especially, you're saying tomorrow I want to be in that state, you need to know what are the rules, because health is a state and a concurrent subject. It's a concurrent subject where the national guidelines come from the center at times for national policies, whereas state designs the policies which are applicable in the state, which is mainly your operator guidelines. Interestingly, the other bit which many people forget is the consumer, and he's the key guy. The habits have changed. Pandemic, what happened? What happened to your OPDs? It fell down. And where were all the people then? On digital platform. All of a sudden, the online consultation sales improved. People who are doing M-Fine, people who are doing Practo, their valuation soared up. Everyone was talking about, I have 1,000. Even my hospital, what we did was immediately we created an app, we got a payment gateway, registered it on Paytm. There's a QR code, patient can go directly pay, and we started doing WhatsApp chats. WhatsApp immediately started reacting to business accounts becoming more active. They created a business vertical. So people changed, your consumer changed, his habits changed. In fact, after COVID, there has been I don't know how much of you have been following the markets, but the IPO market for Zomato was phenomenal when they came post-COVID. The kind of sales they were showing, of course, right now, the same Zomato is struggling with the losses. The Swiggy, the scenario changed. People were sitting and eating food at home, they were ordering. So there was a change in the consumer behavior. Same happened in healthcare. Patients were directly coming online. Interestingly, and so I was in Bangalore at that point of time, and I was talking to my doctors, and he is saying, can you help me, Dr. Mudit? I need an interpreter. I said, for what? Because he knows Kannada, Tamil. And when you come online, he was getting calls from people based out of Ranchi, Veerbhum, Mayurbhanj, and he didn't know how to handle that because he doesn't know the language. So he's saying, can you help me? Because he had 5 stars on the Practo. So from a business point of view, he was highly rated, but from communication point of view, he didn't have that bandwidth. So I said, okay, fine, I'll give you one interpreter with you. That person will interpret. And in the process, he also made efforts to understand Hindi, पेट को क्या बोलते हैं, मरोड़ को क्या बोलते हैं. He said, I don't know what is this marod. He's talking about marod. I said, marod means ऐसे ऐठन यार, cramps. You try to understand all this. So there's a challenge which is happening and emerging in the markets right now. The TPA charges, TPA does contracts with you 8% on the medicine and consumables. Now the definition of medicine keeps changing, consumables keep changing. So you need to be aware of what's included, what is not included. And of course, I think the main important point is the trained manpower, which is becoming a challenge over the time, both from nursing. I see health managers, trained health managers. At one point of time, there were very limited healthcare management schools. Now you have multiple healthcare management schools. What is the training background of the managers? How much on the job training we have to impart to them? In terms of internal management, internal environment point of view, as I said, there's a poor management knowledge, both from maintaining cost, maintaining your EBITDAs, which is your operational efficiencies, engagement with people, poor cost controls, which have been there since quite some time. How much do you invest into human manpower? Cost controls in terms of ratios. Do we really look at manpower to bed ratios? Do we really look at occupancy ratios and then assess the manpower? These are important points. Does it make sense for me to outsource? And I think yesterday you had this conversation where there was a conversation going on for outsourcing or for not outsourcing. And the point is very different. I have seen small and medium hospitals staying away from outsourcing. And the reason for that is because of the cost involved. you have a 5 to 7% as administration fee by the vendor, and then 18% GST. And if a hospital is making 25% profits, EBITDAs, that 25% is, of course, from a housekeeping perspective or from that vertical perspective, it's all washed out. It will not affect on the top line much. But anyway, people would say, why would I invest 30% of my cost paying taxes? Let me get this person in-house, and can we work around that? Many people go to the unorganized sector, which is unfair. I don't think so. That's the way it has to be approached. But then those are the important points which you need to look at. Margins, if you're buying in bulk, are you paying your vendors in time? If you're paying your vendors in time, how much credit is he giving? Is he giving you 5%, 6% on supplies? Are you utilizing the like bulk purchases if you're getting margins in that? These are very, very important. Most important is the capital management, and I think most of the hospitals go bust at this point of time. Capital management is basically what you guys do every day. When you get up, you need to know how much money I'm carrying in my pocket. If I don't have it, I am out. I will not be able to pay for my taxi there, or for my cab today, or for my food today. And same happens with our hospitals. When hospitals start expanding, you all know that in the first 14 months or 18 months is a cash guzzling process where you have to pay salaries, you have to pay to the doctors, you have to pay to the vendors. You will not generate that much amount of revenue. Many hospitals I've seen going literally floundering after first year or second year because they go and take money from the bank. They will show them this कि अरे nursing home तो मैंने ऐसे चलाया था. I could manage with one aya and she could do this. वो सफाई भी करती है, मेरे घर पे चाय भी बनाती है. So she would go in the morning, cook for the doctor, उसका कपड़ा साफ किया, उसका घर ठीक किया, फिर 11 बजे she comes to the hospital. Hospital she'll take care, and then she goes back. So hospital का आया, घर का आया, it's a common thing. तो सब एक ही सर्वेंट से सारा काम चल रहा है. But the moment you go into a 50-bed hospital, पेशेंट को उस मेड से मतलब नहीं है कि उसने डॉक्टर साहब के कपड़े धोए या नहीं, या डॉक्टर साहब का खाना आया है कि नहीं. आप अपना खाना अपना देखिए. मेरे को तो 11 बजे चाय चाहिए, नहीं आया, या मेरा टॉयलेट क्लीन होना चाहिए था सुबह 8 बजे, नहीं हुआ. Those are pain points. The moment you start taking more people, you realize my cost has gone up. It is different from managing a 10 or a 20-bed hospital versus a nursing home versus a 50 or a 100-bed hospital. And then you start fighting with your partners, your operator, कि भाई मेरी तो तुमने कॉस्ट बढ़ा दी. आपने देखा नहीं, मैं नर्सिंग होम में तो मेरे को एक दिन में मैं 10,000 रुपये बनाता था. यहाँ तो एक दिन में मेरे को बैंक से 10,000 रुपये निकालने पड़ रहे हैं. मेरा तो लॉस हो रहा है. Exactly. Because you have not done your maths correctly. You are thinking that the way you were running 10-bedded hospital will be the same as a 50-bed hospital or a 100-bed hospital. And for that, when we do planning, we do create a structure where we create amount, and then from that we have to go. So typical planning is where we say that next 1 month I will be doing so many number of cases. We do a bad case scenario, we do a good case scenario, and then how will it change? Some of you have been operators in nursing homes. You know that birthing has a season. Based on the birthing times, you will know when will the births happen. अब आप expect कर रहे हो कि all of a sudden in the month of April या May you will have so many number of births. It may not happen because शादी का season नहीं आता उससे 9 महीने पहले, तो उस समय births नहीं होंगे. So we all have seasonal trend in our industry, you know. Similarly goes for cardiac. You all know from November, December onwards, the winters set in, your cardiac numbers shoot up. And if you have made a provision कि नहीं मैं तो पूरे साल 100 angiograms करूँगा या 100 plasties करूँगा, not happening. You have to be aware. The moment summer vacations will come, लोग घूमने चल देंगे. वो कहेगा आके करा लेंगे एंजियोग्राम, अभी तो ठीक है, एक वेसल ब्लॉक है, देख लूँगा. Meanwhile your depends which is it, LAD or your other RCAs, and what is the extent of the block. But these are important points in terms of how you do. Lack of information, definitely in terms of what you have invested, what is the kind of information you are seeking about the product. Lack of technical capacity is another important point. Smaller hospitals, they want to grow up, but they don't know the bandwidth in terms of what is required. A 15-bed hospital will not have an ICU. They will create one bed, they will call it an ICU, but that is not the ICU. Let's be very clear. It is not a piped gas supply, there is no venti there. आप एक bubble pap या CPAP को you cannot call as a ICU. एंड आप किसी नर्स से या डॉक्टर से बात करें, बोले हमारे पास एक बहुत बढ़िया आईसीयू है, आप जाके देखोगे, आप उसमें कहोगे इसमें गैस का सिलेंडर तक नहीं है, यहाँ पे क्या हो क्या रहा है, दिल से नहीं पेशेंट हमारा साल में 1-2 दफ़े ही आते हैं सर, बाकी तो हम बहुत अच्छा मैनेज करते हैं उनको. बट द मोमेंट यू गो इन टू 50-bed हॉस्पिटल और 100-bed हॉस्पिटल, यू हैव डेडिकेटेड बेड आईसीयूज, इट्स अ डिफरेंट बॉल गेम. ऑक्सीजन आएगा ही आएगा उसमें, पाइप गैस सप्लाई, और उसके लिए यू विल हैव टू investment of an average ventilator which you are going to cost will not be less than 7 to 10 lakhs. You have to get a good ventilator to put there and then see how you will manage. It's a huge investment. So people need to understand these things when they are grading, and if you are not knowing that knowledge, but naturally if you enter into something without much knowledge, you will enter into problems. And I think the best is the mindset. Many doctors and most of us feel that स्ट्रैटेजी मैनेजमेंट और ये सब तो स्कूल में पढ़ाते हैं, ठीक है ना, दिस इज़ यूजलेस, मैंने 10 साल चलाया, मुझे सब पता है. एंड आई थिंक दैट्स वन ऑफ द बिगेस्ट fallacies we make. See, knowledge is not something bad to gain and to be aware of, but to implement is, of course, I think you need to be very sure of what you are doing. When we started our career, we thought we know the human body very well, but you don't. You don't even know how much potassium if you inject or take, how will it affect your cardiac work? You might have a cardiac arrest. We didn't know that. आप सोचो हाँ खा सकते हैं, जितना खाना है खाओ, जो खाना है खाओ. That's not how the body responds. So knowledge is very important, and the mindset of knowing everything is very important. So what have we looked at? So there were various studies which have come forward, and this is not based out of something out of my mind, but this is based on certain empirical studies where they have said that in small and medium hospitals you need to look at strategies. Some of the biggest challenges they all find is, as I said, responding to the external environment, the cost leadership, which is mainly the operations, because once you set up something, then you have to be very, very frugal on cost, you have to be very observant how you are doing it. We need to look at how we can reduce the overheads, how we can do right from, and it starts right from the point of entrance. What kind of material the housekeeping is using, how many people in housekeeping, what kind of electricity, what kind of LED lights, what is your wage bill, which is your most important bill. It takes about roughly, including your doctors are roughly about 25 to 30%, remaining 15%, 12 to 15% is your manpower cost, 45 to 50% of the cost is sitting in your human beings. Managing those are very important, and I keep telling that in all my talks, that managing the consultants is the key area, talking to them continuously, making, I think most of the organization think that the doctors are against the organizations, and doctors also feel that the management is against them. Unfortunately, it is not so. You need to have a continuous communication with them. They are like the on-stage performers, you know. The audience needs to talk to the on-stage performer. They don't know the director who's sitting behind it or the operators. So as a director of the organization, you create the infrastructure and the doctors perform there. And you have to take him in faith, you know. आपको बताना पड़ेगा जब आर्टिस्ट को when you perform, जब मैं इधर आया तो I had to understand whether my laptop can fix into this or not. I directly can't walk in and start plugging in my. So you have to take all the stakeholders into confidence, talk to your doctors. Just for your example, if you start using a certain brand of sutures versus another brand, your cost can vary about 25 to 30%. And it totally depends upon you, what you are able to talk to and convince your consultant at. And it can result in a saving of almost 10 to 15% in your consumable cost. So you need to be aware of that. In terms of your product, how you are doing that. So how you are pricing your product is also very important, because once in a competitive environment, I'll be very clear, India is a price sensitive market. You can claim whatever you want to. The number of cars being sold is Maruti, not BMWs. If you talk about volumes, the highest number of cars which are get sold is either Maruti or Hyundai, not BMWs. So there are like ratios which are built in, how much is a BMW, how many BMWs over how many Maruti Suzukis. India is a price sensitive market. Everyone aspires to grow, which is a human nature, to grow to the next level, from this level to next level, based on his affordability. So he will always see his cost, he will always see his price, and then he will decide what I want. So based on that, when you are pricing any product, you need to be aware that what you are going to price your product at. Outsourcing non-core areas is a very typical thing where you know this is not my forte. I will not jump into it. Why can't I outsource and see? And I think that conversation which you had, so to a certain level, of a certain level of hospitals, I can handle it. Beyond that, I don't want to touch it. Let a professional handle it who knows how to handle that. Of course, being aware of the environment and responding to that. As I said, during pandemic, many people got wiped out, where many people made enough money to make a 200-bed hospital out of that. How would you look at your product? How do you differentiate your product? How is your angiogram or angioplasty different? Are you doing something different in terms of deliveries? How am I addressing deliveries? I am creating a service concept. You go to Neotias in Kolkata, okay? How they deliver that, they do deliveries. What will be an average delivery in Lucknow? Any thought process? You would know? Typically around a 35 to 40,000 or 50,000 would be a delivery price points in a nursing home. You go to Neotias in Calcutta, your price will be 2.5 to 3 lakhs for a delivery. And you are thinking, what the hell? The child is going to come out the same route. Child is not going to wear some new clothes. He is not going to be studded with diamonds or something when he is going to come out. He will be the normal child with an umbilical cord wriggling out of the tummy of the mom. But they are charging 3 lakhs. And how do they charge 3 lakhs is because the kind of services they offer. Phenomenal service to the parents, phenomenal service. So there is one area where the parents said they will get you chai, nashta, samosas, continuous trays going on. Women sit separately. They are talking to the mother, the women. So they create an ambience that the delivery is almost like a marriage hall where people are coming, greeting, doing everything. But still the privacy of the patient is maintained, and they don't see that as a disease. They are talking about it's a natural phenomenon. And we all have been students. We all know that one of the first things which we learned in first and second standard was how do you differentiate between living and non-living. They respire, they excrete, they procreate. Those were the things. So it's a normal human physiology. And that's what is happening. So he's saying we are doing normal. There's no disease involved here. Let's make it a happy occasion. And they created this whole happiness and a wellness concept around it. And there are people who are taking it. So I think that's very important, which is also part of your innovation, both internally and externally. Resource utilization in terms of the brand. Today you have created a brand. In Lucknow when you walk around, Medanta is a brand, Sahara is a brand. These are branded hospitals. And these are automatically, if you think tomorrow Medanta opens another center nearby, the patient knows this is the same Medanta. He would definitely like to walk in there. I was talking to Jyotir right now, and he was telling me that they have this brand of Pratiksha hospitals. Now, when you go to Northeast, that's a reputed brand. You know, people know about that brand. So when you see the same sign, you see the same logo, you will buy. Same happens with your retail sector. In retail tomorrow, when you go and buy and you see it's a Van Heusen shirt or a Van Heusen product, you know it's the same Van Heusen. You can't be cheated. Of course, there are cheating. There are fabricated Van Heusens also, with the V missing or a A being smaller than the V or a larger than the V. But I'm not talking about that. I'm saying as a product, it will attract a patient. And then how you're going to technical, I said, training the manpower, brands and services, and of course, then the other part of the resources being the technical and the training your manpower, which is important. Acquiring is a laser product. So as I said, unique product. Now certain smaller hospitals, they cannot afford an angiogram or a cath lab or an MRI or a CT. But maybe you can start doing something which brings benefit to the patient. As I said, service is one part. Technicality in terms of, can we do urology with laser surgeries? You know, they are literally like you bring your bag in like a trolley, you can bring in those stuff, do laser surgeries. Average length of stay is very less, patient is very happy, he goes off home in the same day in the evening, his prostate is done. Otherwise, you go to a routine hospital, 1 day or a 1.5 day length of stay. So there's a huge drastic change. Same goes for peripheral vascular surgeries. When you're doing varicose veins, you just use laser surgeries. You don't have to put, strip, what you have read in your surgical books doesn't happen anymore. So there's a dynamic shift which is happening in terms of new techniques which can be adopted in smaller hospitals and can give you a better revenue and your survival. Also bring in your name. कि उस हॉस्पिटल में तो 10 दिन में ही काम हो जाता, 10 घंटे में ही काम हो जाता, सुबह जाओ शाम को आ जाओ, आप कहाँ जा रहे हो, और कॉस्ट भी कम है. So then you bring a differentiation in the market. As I said, You should not be, you have to be very focused. You cannot be कि आज decide किया कि we will do this, after half an hour एक और आदमी मिला, उसने कहा अरे सर क्या कर रहे हो आप, नहीं 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 सर आप don't do gynae obs, you should do cardiac. फिर थोड़ी देर बाद आप किसी से मिलने, उसने कहा सर कार्डियक तो बिल्कुल चला गया, अब आप ऑन्को कर लो. सर डू यू नो द कॉस्ट ऑफ इन्वेस्टमेंट इन ईच वन ऑफ देम. आप तो बैठ के आ गए, देन यू आर थिंकिंग कि अब मैं ऑन्कोलॉजी के लिए 60 करोड़ चाहिए, उसमें मेरे को लिनायक आएगा 18 करोड़ का, 14 करोड़ का लिनायक लूँगा, 6 करोड़ का पेट लूँगा, 20 करोड़ उसका इलेक्ट्रिसिटी खर्चा. डू यू इवन नो? So what is the best way to kill your friend? If you have a friend, I mean friend in terms of he's a competition, what should you do to him? Go and gift him a white elephant. ठीक है ना, उसको एक एलिफेंट दे दो आप. आपने एलिफेंट के साथ मालूम है क्या प्रॉब्लम है? एलिफेंट देखने में तो ठीक है, उसको डेली जब वो चारा खिलाएगा ना, उसका पूरा पैसा निकल जाएगा. He will be fed up of that gift of yours. So if you want to gift your friend, friend in terms of inverted commas, the person is your competition, you don't like him basically, उसको जाके गिफ्ट कर दिया हाथी, उसके बाद वो सर फोड़ता रहेगा. Many a times you will find your friends कि I have got this car, brand new car है, बहुत बढ़िया है, he's got upgraded into a BMW. आप पूछोगे वही हिंदी अपना वाला सवाल कि कितना देती है, वो कहेगा भैया ये मत पूछो बस कि कितना देती है, बट ये BMW है. तो जो BMW खरीदता है वो कभी ये नहीं पूछता कितना देती है ना. दैट्स अ डिफरेंट जनरेशन जॉनर ऑफ पीपल कि वो जो BMW में आता है. हम लोगों का ये होगा कि नहीं भाई पहले पता कर लो कितना देती है, नहीं लेने का लेने का. So that's a differential which you create when you're doing about it. The focus strategy is, I know this is my money, this is how I have to do. And I think yesterday we were having a discussion with some of my friends and we were talking about when you're talking about your focus strategy, most important point is the time management in that. If you are very much aware that I have to do this project in 5 months, 6 months or 1 year, do it. Because the project overrun cost is phenomenal as the time passes. Manpower cost goes up, cost of procurement goes up. It can change, it can just change what you started off thinking it will go as 30 crores might end up with 35, 40, 50 crores also. There are project overruns to almost 35-40% because of the delay. And that gets the idea of being stuck in the middle. You're not taking a call. ये करना है कि वो करना है, रोज नए नए idea आ रहे हैं, and that process elaborates a lot. So how do we go about it? We have evaluated what causes the problems. Let's talk about the solutions around it. So what we do, as I said, need to at least focus on 2 strategies. As I said, cost controls, USPs which we talked about in my previous slides. We talked about cost leadership. We talked about responding to the external environment. That means your strategic thought process changes. And then you look at sales. So either cost and sales with a focus on leadership. And when I'm saying focus on 2, doesn't mean you neglect the third one, ki environment mein kuch bhi ho raha, I'm not interested. They are all interrelated. So that would be very, very important. Second is focused strategy, that I have to do this work and I will be in this geography or I will be in this vertical, I will focus on this. And then create a USP if possible to acquire a talent or a strategy which will help you move. As I said, cost controls are the most important ones which will grow. Outsourcing these activities which are devoid of cost involved, but that is a part of your cost. Committed employees, as I said, and trained employees. So technically, as I said, everyone cannot manage a hospital. Let's be very clear. चाचा जी हैं, चाचा जी मेरे को बहुत अच्छे लगते हैं, that is fine. पर चाचा जी can manage the hospital is a very different thing. चाचा जी ने मुझे manage किया हुआ doesn't mean चाचा जी will manage the hospital. So let's be very clear. Technical know-how, technical input is different in terms of managing, because this is, you are talking about a 5 crore business or a 10 crore business is very different from managing your day-to-day driver, your servant or anyone at home. So you need to have a dedicated, knowledgeable team which is doing this. And as I said, mindset, where any strategy goes कि चलो आज ये कर लिया, आज oncology कर लिया, कल निकले cardiology कर लिया, परसों निकले तो gynae obs कर लिया. No, that will not help you. You have to be very clear. This is the mindset. I am going to do this in a time phase. This is what the product is. I am saying you take time, but once you have made your thought process, then let's not deviate midway कि अब मैं इसमें ये कर लेता हूँ. And you will find that in many nursing homes and hospitals when you will go, एकदम से आप चल रहे हो, कॉरिडोर चेंज हो गया. आपने कहा ये सर ये डिफरेंस क्यों हो गया? कि नहीं हम पहले सोच रहे थे कि हम इधर ओटी बनाएंगे ही नहीं, हम अब इधर हमने ओटी बना लिया तो उसका गुफा जैसा मुंह हो गया, आगे तो इतना खुला हुआ है, आगे जाके एकदम से सकरा हो गया. वो ये क्या कि हम पहले इधर टॉयलेट्स थे, हमने उनको तोड़ के अब इधर ओटी बना लिया. नॉट रियलाइजिंग कि गैलरी साइजेस, हाउ विल यू व्हील आउट द पेशेंट, दीज आर ऑल चैलेंजेस. नहीं हो जाएगा, आ जाएगा, ट्रॉली में डाल देंगे, मतलब ही इज़ नॉट अ पेशेंट, ही इज़ अ पेशेंट एंड यू आर क्रिएटिंग अ ब्रांडेड अप्रोच. आप सोच रहे हो कि मैं उसमें से आई विल चार्ज हिम 2 लाख रुपीज़ फॉर अ सर्जरी, पर उसको बोरी के जैसे बांध के मैं एक गट्ठर में बांध के भेज दूंगा. ही इज़ नॉट गोइंग टू पे यू फॉर दैट. देयर आर बेटर ऑप्शंस इन द मार्केट. So I think that's very important, that the mindset, cost controls, and the sales leverage, of course, with a focused strategy on these two. I think I'm just up my time, so thank you very much. Lovely talking to all of you. Thanks.